The Sydney Morning Herald splashed desperate bid to get hospital prepared. The federal government is seeking urgent advice from intensive care doctors about pressure on hospital wards from sustained demand that will last for months, shaping advice for National Cabinet on whether the health system can cope when lockdowns are eased. Now, this is a legitimate concern, and I can understand why they are seeking those types of assurances.
Yeah, you can. You look at the scenario here in the West, Glee. So we're cancelling elective surgery for a month from Wednesday simply because of the demand on the hospital system. WA is about to break a record tomorrow of over 6,000 hours of ambulances being ramped throughout the month of August. That's setting a brand new benchmark, a brand new record. And Paul Garvey carried the story on the front page of the Australian newspaper this morning, where it indicated that you go back 5 years ago, the then opposition health spokesman, Roger Cook, at 1,000 hours, said it was a horrible story, a horror story. He's now just clocked up 6,000 hours, Gleeso, and we have no COVID here in the West, and we're having to delay elective surgeries just simply because the emergency departments cannot cope with the number of people presenting to Perth hospitals. So this is a state, obviously, that is COVID-free. It has no restrictions. In New South Wales at the moment, they've got more than 100 people in ICU. I think they've got more than 800 people now in hospital battling COVID-19. You can understand that needs to be the immediate priority. Of course it does. But that has to be factored in to any particular plans that are made in each and every state about being able to adequately supply and provide its citizens with the desperate first aid that they'd require in any sort of situation. And I think, Liso, that is why you see such a conservative approach from the McGowan government here in the West about not agreeing to those 70 or 80% national vaccination targets, because quite simply, the health system over here, Gleeso, would not be able to cope. Yeah. The health system in the West is sick.
Well, let's have a look at that. You mentioned that, Ollie. The front page of the West Australian. Premier's 70% fear. Treasurer Mark McGowan has given his clearest warning yet. He will keep WA's border closed even after 70% of Western Australians are inoculated against the coronavirus. He said opening the WA at that point could cost hundreds of lives and shut down the mining industry. Well, you've just preempted the reasons why. But why does WA stick around and, sign up to National Cabinet? I mean, if I were Morrison, I'd just make sure that when they put those screens up on the Fridays that they have National Cabinet, that they just make sure that the screen from WA just goes black, just a test pattern. Because old mate McGowan, he shouldn't even be sticking around during those particular discussions. I mean, if he doesn't want to be part of Australia, secede and get out.
Well, tried to blame today the NDIS, tried to blame the aged care system, tried to blame the federal government as well for the hospital crisis. Mark McGowan's now been in power for 5 years, Gleeso. The state government cannot duck. It cannot weave. It has to take responsibility for the hospital crisis in Western Australia, for the health system, of which he started the campaign of budget repair when he came to office 5 years ago, took 2% of the budget out in year one, 1% in year two, and look at the situation Western Australia is in now, again, with the record ambulance ramping to be recorded in August. Elective surgeries being delayed and we don't have COVID-19. So we're happy to be part of Australia when it suits us. We're happy to be Western Australia when it doesn't suit us.